Cosmetic surgery can improve a person's appearance, self-esteem, and self-confidence. But what all goes into procedures like this? In this episode of Being Well, I'll pick the brain of HSHS St. Anthony's Memorial Hospital plastic surgeon, Dr. Dean Page.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are going to be talking about all things cosmetic surgery. We've got a new guest on the show today. We are welcoming in Dr. Dean Page. Welcome to Being Well. Thank you for being here today.
Well, thank you for having me.
Of course. So just so we can let folks at home get to know who you are, can you give us a little bit of background? How did you end up doing what you're doing?
Well, it all started after high school. I went to college at Allegheny College in Meadville, Pennsylvania. I then went to medical school at the University of Pittsburgh. And then I had a Navy scholarship for the first part of my training, so I ended up doing my surgery residency, general surgery residency at Bethesda Naval Hospital. And then after that, I did some work with the Navy, and about 3 years later, I did my plastic surgery residency at the University of Cincinnati. And from there, I went on and did a fellowship in Houston, Texas on reconstructive breast surgery, and then went back to Bethesda Naval Hospital and practiced there for 2 years to finish out my time in the Navy for a total of 12 years. Wow. Then I went into private practice for a while, and I currently work at HSHS Medical Group in Effingham, Illinois at St. Anthony's Hospital.
Well, first off, thank you for your service.
Oh, you're welcome.
My goodness. So you've been everywhere, kind of like a Johnny Cash song.
Yeah, sort of, kind of, yeah.
So as we're kind of delving into this topic today, you were telling me that there's a kind of a rich history and evolving history around this type of surgery. So can you kind of fill us in on what that looks like?
Sure. Well, plastic surgery years ago it started out really with hand and reconstructive surgery, the hand. And then it progressed on. They formed an organization and a board for plastic surgery and branched out into doing reconstruction for all parts of the body. It wasn't really until later that cosmetic surgery became a big part of plastic surgery. Currently, when people hear the word plastic surgery, they think of cosmetic surgery, but truly it started out with a lot of reconstructive work, and now it's just a lay interpretation of that specialty. But we are the board that is, or the American Board of Plastic Surgery is the board for cosmetic surgeons. There's no other board, and I always tell people that when you're shopping for a surgeon or to have a procedure done, you should look for somebody who's board certified by the American Board of Plastic Surgery.
No, this is nothing to play with.
No. Yeah. But yeah, you don't want to go to Kmart when you're shopping for plastic surgery. So.
And so as you are trying to locate a surgeon, that certification, how can I what am I looking for? Is it, letters behind someone's name, or?
You can actually go on the internet and look up the American Board of Plastic Surgery, and it'll tell everybody who's actually board certified and whether their credentials are current or not. The other place to look is the American Society of Plastic Surgeons. It's plasticsurgery.org, and most of the plastic surgeons who are board certified are also on that group, or that's more of a professional group, not the actual board certification group. So true board certification, you can look for everybody on the American Board of Plastic Surgery, but everybody who's in the American Society of Plastic Surgeons are also board certified as well. So,
okay.
And then as far as cosmetic surgery, the American Society for Cosmetic Surgery is also another place where board certified plastic surgeons are registered and basically show examples and have their websites connected to that.
Because before we got recording, you were kind of giving me an example that at this point you could walk into.
Yeah, so if you have MD after your name, you can hang your shingle up for any specialty you want, but to be board certified sets your physician or doctor ahead of everyone else because you've completed examinations. In plastic surgery, it's written and oral examinations, as well as every year now we have to do continuing certification skills. It used to be once every 5 years, and it's been changed now so that we do a little bit every year, so it's not all one big retest, but we're constantly learning and maintaining our skills and maintaining our board certification.
Which is so important because I think when a lot of people hear cosmetic surgery, they might think of the show like Botched, where plastic surgery goes really, really wrong. Or they think of maybe a tabloid they've seen and a star was, trying to get a nip and a tuck and they came out looking kind of like a balloon. So
yeah, there's been some horror stories about people, setting up operating rooms in their homes or garages, and then they do surgery out of those, and without being board certified, so not having the proper anesthesia and so forth. And there was a big crisis in Florida years ago where they had to limit what people could set up as an outpatient surgery center, because those people who are not board certified can't get hospital privileges, and it's harder for them to get credentialed to be an outpatient surgery center as well. Every year when I sign up for the American Society of Plastic Surgeons and pay my dues, I have to verify that I only operate in certified facilities.
Okay, so we've laid the groundwork.
Yes.
You are so legitimate. you are a trusted professional in this area.
Yep.
So let's dive into this topic.
Sure.
So types of cosmetic surgeries and procedures that you all offer.
So, myself, I'm kind of a general guy right now. I mean, we do some facial. My favorite things to do are breast and body contouring, but people sometimes focus only on facial plastic surgery. I think it's a lot of ground to cover, and so you want to find somebody who does a lot of whatever they're doing, is what I would say. We do a lot of eyelids and things like that. ENT doctors as well as plastic surgeons do cosmetic nasal surgery and facial surgery. And then we're truly the ones who are doing all the breast and abdominal surgery. Mm-hmm.
So backing up into talking about breast augmentation, those sorts of things.
Yeah.
Even the tie you're sporting.
Oh.
You were talking about doing reconstructive surgery for breast cancer patients.
Correct.
I mean, that is huge for mental health, self-confidence. Please talk about that and the kind of work that you do with that.
Sure. So as I mentioned, I did an extra fellowship in breast reconstruction. So there's a number of different techniques that we use for reconstructing breasts after mastectomy surgery, and now even more emphasis on lumpectomy surgery, because as the techniques advance for treating breast cancer, we're taking less and less of the breast itself and then using other adjuvant treatments to make sure that the cancer doesn't come back. So sometimes we're not taking the whole breast, we're using only part of it, and then it's my job to kind of take what's left and put it back together again and maybe add an implant or tissue from another part of the body to help put things back together. So it's usually a process that takes several months because there's different stages for the different kinds of procedures that we do. Probably the most common thing we do now is what we call tissue expanders, and then that goes in right after the mastectomy, and that's inflated till we reach an appropriate size or get a good pocket, and then we let that sit for about 3 months, and then we go back and replace that tissue expander, or a balloon basically, with a permanent implant, and then move on from there as needed. Recently we've also been doing fat grafting and so forth to help recreate breasts and smooth out contours after mastectomies too. So
maybe I dove in a little too headfirst with that.
Yeah.
To back up,
sure.
If I'm somebody who is considering this type of procedure, what makes someone a good candidate for it?
So you're talking about cosmetic, really?
Yeah,
Okay,
where do I start?
Sure. So I think, we all have things we'd like to change. That's what I say. So I think that's an important part of it, deciding what's right for you. Some people get influenced by friends or husbands or whatever about what's right or what they need. I think it's important that people decide for themselves what they really want to do. And then once you've decided what things bother you or what you'd like to have changed, then that's when it's time to see a plastic surgeon and have a consultation and move forward with whatever area concerns you. And in terms of breasts and preparing for that, I think you want to be fully mature. So we like to operate on young adults, not girls, basically. It's not 16 and go get your breast implants type thing.
Sure.
It's better to be fully mature before you do that. My personal recommendation is that if you're planning on getting pregnant and you know it, then you should probably hold off on cosmetic surgery of the breast until after you're done with all your children, because lactation and or just being pregnant, your breasts engorge, and that causes the shape to change, and it makes it, it takes a step back if you've already had some work done, basically. So I say, when you're ready, come and do it. I think the other important thing is to be at what I call your happy weight, where you're not starving yourself and exercising 5 hours a day to maintain a certain weight. You want to be a place where you can be, not necessarily what all the charts say, but something that you're happy with, because then when we manipulate or change tissue or add implants, whatever we're going to do for our surgery, then we're adjusting it to who you are and what you want to be, basically.
Right, because you don't want the body changing a lot.
Correct.
One of the questions I have down is, how long do breast implants last?
So that's a good question. That we used to say all the time, 15 to 20 years. And I think a big misconception is that, when I hit 20 years, I got to go get new breast implants. And that's truly not the case. Breast implants are good until they fail or you have a problem with them. And so there's no set date and time. If you have breast implants, I've had people go for 25 and 30 years without any trouble. And then, they at some point have a failure or have what we call capsular contracture, where there's scar tissue that forms around the outside of the implant, and that has to be either loosened or removed. And then at that later surgery, we decide whether the implants need to be changed out or not. I like getting another 50,000 miles out, new set of tires, right? So
Sure.
And it also depends on the implants themselves. Like the newer gel implants that we have, because they're cohesive, where the gel is no longer liquid. Back in the 60s and or late 60s, early 70s, the gel used to be more liquid. So if you had a rupture, you would figure it out. That's where there was a bit of controversy about whether they were harmful or not.
Okay.
And from that emerged, after about 10 or 11 year moratorium, more cohesive gel implants where if you cut into them, the gel didn't even leak out, basically. So now we've even moved a step further to what we call stable form implants, where you can cut a wedge out of it, nothing comes out, you can squeeze it, it bulges, but you let go and it actually goes back in. So those implants are probably, unless we are doing investigations like MRIs or high resolution ultrasounds, we might not even know when those implants leak at all, unless there's a problem like that scar tissue or capsular contracture that I mentioned before. So I would say that everybody's different. The average, I would say, is somewhere between 15 and 20 years, and you don't have to have them replaced unless there's a problem.
And so what is kind of the time frame from when I consult with you, scheduling the surgery, how long to recoup? What does that kind of look like?
Sure. So we have initial consultation, and I think, again, because this is cosmetic, we don't want to put anybody at more risk than they have to be. So we want you to be as healthy as you can be before you approach surgery. So one of the basic concepts is, are you healthy enough to undergo elective cosmetic surgery? And once we've decided that's okay, then my next step generally with people is making sure their breast tissue is good. So if you're over the age of 35, I like everybody to have a screening mammogram before they have any surgery done to their breast, because you don't want to come next year for your regular mammogram and find out that there's an abnormality there, and now we've done something to fix you up, and we're going to disrupt that by doing investigative work to figure out if there's a cancer, or heaven forbid that we find a cancer and we need to do something to fix it up. So, so good mammogram, good health, and then we talk about the different options. So in some people, it's an issue of volume. They want to be bigger. Some people, it's an issue of I'm not as perky as I used to be, and then we tighten tissues up. That's called a mastopexy or a breast lift. And so once we have that consultation, we decide what we're going to do. Then we talk about appropriate timing, and depending on the OR schedule and someone's urgency of what they have coming up. I think the most important thing to understand is that after the surgery, there's 2 weeks where, at least the way I run my practice, is 2 weeks where I don't want you doing much activity at all, and then we kind of set you loose, but no swimming for another 2 weeks, and then you can kind of hit the road, but nothing that hurts or pulls for a total of 6 weeks. And then after 6 weeks, all holds or no holds barred, you can do whatever you want. And but I do think that it's somewhere between 3 and 6 months that the implants actually settle out and really look as good as they're going to look. Sometimes we're waiting for your breast tissue to what we call efface or stretch out behind or in front of the implant. So it takes some time for that to happen. It's kind of like a pregnancy. As the implant settles into place, the skin thins and stretches, and until that happens, they can look a little high or a little tight or too big. But once they settle in somewhere between that 3 and 6 month range, that's when I'd say that you're 100%. So if you're thinking about surgery for 4th of July, it's too late, basically.
So are you in that process of the 3 to 6 months? Am I coming back to you to check on progress, make sure things are looking okay?
Right. So our general follow-up regimen is we see you at 48 hours. So after surgery, we put an elastic wrap on you. We leave that on for 48 hours. And then you come back at that time, we take it off, make sure everything's going okay. Depending on how the implants are sitting, we sometimes add a breast band to help push them down a little bit, or say maybe wear nothing at all, let them settle on their own. And then we see you again at 2 weeks, and then at 1 month, and then at 3 months, and then 6 months. And then that's kind of the place where we say, okay, how are things doing? What do you think? And do we need to do any other alterations or changes?
Is this a painful process?
The answer is it depends.
Okay.
Some people are more tolerant to pain, others are not. I rarely prescribe more than Vicodin pills for breast augmentation. And I think with proper counseling and understanding how the procedure works and what to expect afterwards, knowing that you're going to have a couple days of what I call the regret phase of plastic surgery. But after you get past 48 hours, you can take Motrin and Tylenol. And usually we stop any narcotic pain medication after 48 hours.
Gotcha. It's important for people to know.
Well,
you don't want to just think you snap your fingers and all of a sudden you're a new you.
Sure, and I think the other concept, worldwide now, or whatever, at least in the United States, is we used to do pain scores on people to figure out, whether we should give them more medicine or not. Well, to get people to a 10 or a 0 or 1, you'd have to give them so much narcotic that it would make them sleepy. So putting everybody to sleep is not a goal. Our current target is manageable pain, and I think that can be achieved with good preoperative counseling and then proper medication selection afterwards.
So some other topics that HSHS had kind of suggested that we talk about, a tummy tuck and a mommy makeover, are they different?
Sure. Well, yes and no. So the concept of a mommy makeover is just kind of, the two things that go bad after pregnancy are your breast shape and texture, as well as the extra skin you might be left with in your abdomen afterwards.
Okay.
So kind of my definition of a mommy makeover is taking care of those two areas. I mean, other people find they gain weight, so they might want liposuction or things like that, but traditionally, or for most surgeons, that's the areas that we focus on after pregnancy, is the breast and the abdomen. Sometimes we can do all those procedures at once. Sometimes a tummy tuck gets more involved, and then we shouldn't be doing long extended procedures on both the breast and the abdomen at the same time. So kind of what's right for the patient is what we try and target. We want to stay under 6 hours for elective surgery because that's where the risk for complication goes up afterwards. And so sometimes we do it in stages, sometimes we can do it all at once, but it's taking care of the skin and shape of the abdomen and taking care of the skin and shape of the breasts after surgery is what I would define as a mommy makeover. you were asking about tummy tucks too? Okay, so tummy tuck is the main part of that procedure, is removing the excess skin that accumulates at the lower part of the abdomen, usually below the umbilicus. And what we do is make an incision and take out a large ellipse of skin that tapers out to your hip bone. And then we loosen that up and bring it all the way down. And then once we bring the skin down, we make a hole and bring the belly button back out. We actually cut around the belly button while we're taking out that big piece of skin and moving it down. You kind of wake up in a beach chair position, and then the recovery involves wearing a compression garment. Most of us don't use drains anymore for that procedure. There's some suturing techniques that we use that help keep fluid from accumulating, but from time to time people will have fluid that accumulates under that area of skin that we moved, and we just remove that at an outpatient visit.
So I know we've been hitting on the ladies a lot, okay?
Yeah.
But do men ever come see you for a variety of things?
Sure. I think it's, I would still say it's more than 90-10 women, but yeah, men do come for surgery. We've done a fair amount of gynecomastia or male breast surgery to reduce the size. There's different procedures that we do for that, including sometimes liposuction, sometimes actually taking out a small amount of tissue, and sometimes literally doing like a breast reduction similar to what we would do for a woman who has large breasts. And with bariatric surgery, we've had men come for post-bariatric surgery for taking off loose skin as well. But again, I think women far outnumber the men in those statistics.
Fair enough. So insurance, a lot of this is
I would say
covered.
the definition of cosmetic surgery is it's not covered by insurance.
Okay.
So if you're doing something 100% for appearance, it's generally not covered by insurance. I've had some weird things in my career where some policeman's insurance from New York had some great benefit where this gentleman's wife came and she got her Botox injections and so forth paid for by his insurance. So but that's one case out of thousands where insurance paid for it, but it would have to be a special rider on your policy about what was covered. But most often, no. It's for purely cosmetic reasons. It's not covered by insurance.
Okie dokie. And then is there any sort of a consult fee when someone comes to see you?
Sure. We have a basic consult fee of $100, and that's to kind of cover our time in the clinic, and because we treat even cosmetic patients as a medical patient. So we do a health survey, we look at your medications, we do a thorough physical exam. So that kind of covers our basis for that. But if you decide to have a cosmetic procedure in our office, then that $100 is refunded back to you at your time of payment when you come to do the surgery itself.
And then if I'm somebody who is looking to get connected with your services specifically, how does someone get a hold of you?
Sure. So we have a general clinic phone number, and I don't know if you flash that on the screen or whatever, but
we can do that.
Yeah, 217-540-2350. And that gets you into the front desk people who will schedule you for a consult and tell you the details of it and get you set up at your convenience.
Before we wrap up, I do want to ask, you've talked about a couple of cases where maybe things can happen to go wrong.
Yeah.
It does happen.
Sure.
What are some signs or symptoms that somebody should look out for?
Well, I think just like with any surgery, there's risks of bleeding and infection anytime you cut the skin. So those are always things that we look for. You can have bleeding around your implant or in your abdominoplasty. So we have ways of taking care of those either in the office with needle drainage, or if they're bad or there's a fair amount of bleeding, then sometimes we do have to go back to the hospital to drain that area and then sew things back up again. Those are extremes, though, I would say, for the most part, because we're careful about patient selection and making sure people aren't on blood thinners and they've managed their medications appropriately. We have a low complication rate. But yeah, stuff happens, and that's why it's a big deal, and that's why I say stick with somebody who's board certified and knows how to not only do the surgery, but can handle the complications and has appropriate affiliation with a hospital. So if you need to go and have some emergency work done afterwards, that person's qualified to do that.
Now, in our last minute or so here, can you talk about any sort of success story you've had that maybe meant a lot to you, meant a lot to the patient?
Yeah, I had a bariatric patient who came and had 4 different rounds of surgery with me. And at the end of it, after she had finished her last procedure and she was well recovered, she sent me this globe that was, it was solar powered or wherever, and it spun around and sat on my desk. And she put a metal plate on it. She said, "Thank you, Dr. Page, you changed my world."
Aww.
And that's, of all the cosmetic things that I would tell you that I remember, that's really one of them, because I really did. I mean, she had pounds and pounds of skin removed when it was all done, and I did make her feel a lot better. It was very rewarding to me too. So, I mean, I enjoy helping people all the time. That's why I got into the business in the first place. But if you ask me about a certain one that I truly remember, that's really it. But we work hard every day to make everybody feel better. So.
Self-confidence, quality of life, both are so important, and you are helping patients walk through that.
Yep. And like we talked about earlier too, the cancer side of it as well. I mean, it's, you know, cancer is a devastating event, and to be able to help somebody get back as close to normal as they can be, for me, that's a rush too. That's really, that's why I did that extra work at the beginning of my career in breast reconstruction.
Well, Dr. Dean Page, thank you so much for coming on Being Well. I sure appreciate your time.
Well, thanks for having me. I appreciate it.
Of course, and we thank our viewers for joining us for this episode of Being Well, and we hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.